My name is Amber Ford, and I'm a public health educator at the Knox County Health Department. Thank you for taking the time today to watch this presentation about the COVID-19 vaccines available to us here in Knox County. The purpose of this presentation is to address some of the most common questions, myths, and misinformation about the COVID-19 vaccines. If there are any questions that we do not answer in this presentation, we'll refer you to some additional resources at the end of this session that you may also find helpful. We hope that you find this session useful and helpful. Before we begin our discussion about the COVID-19 vaccine, let's start with a brief overview of what COVID-19 is. COVID-19 is caused by the SARS-CoV-2 virus and can result in a range of illness. COVID-19 is primarily spread from person to person between people who are in close contact, 6 feet or less, for 15 or more minutes over a cumulative 24-hour period. It can be spread through respiratory droplets from an infected person, and then those droplets can land on the mouth or nose or be inhaled by the lungs by others nearby. It's unknown how COVID-19 will affect each person. Some people might have mild symptoms or even be asymptomatic, while others may end up needing hospital care. Older people and those with medical conditions are more at risk of serious illness. Symptoms of COVID-19. Some of the most common symptoms of COVID-19 are fever and chills, cough, and shortness of breath or difficulty breathing. Other symptoms may include fatigue, muscle or body aches, headaches, sore throat, congestion, runny nose, nausea, vomiting, diarrhea, and loss of taste or smell. So a number of things. There are also severe symptoms where emergency medical care should be sought after immediately. Symptoms to look out for include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. The best way to protect you and your family is through the 5 core actions. So number 1, practice physical distancing. 2, wear cloth face coverings. 3, practice proper hand washing. 4, clean and sanitize surfaces regularly. And 5, stay home if you're sick. Now, we would also recommend to protect you and your family that you get vaccinated when it's available to you. Now let's take a look at the COVID-19 vaccines. How do vaccines work and why are they important? Understanding how vaccines work is crucial in increasing confidence about the COVID-19 vaccine. Vaccines help people develop immunity to viruses by developing antibodies to a specific virus or germ. When the body encounters this virus again, it already knows how to respond and not to get sick. COVID-19 vaccines are important to keep you, your family, and your community healthy and safe. They help us return to normal and help stop the COVID-19 pandemic. What is an mRNA vaccine? In an mRNA vaccine, the important thing to remember is that no viral particles are injected into your body. The vaccine gives your body the instructions to build a protein that is found in the virus that causes COVID-19. Your body sees that this protein doesn't belong and then begins making antibodies to fight COVID-19. If your body were to someday see the virus, it will remember that protein and know how to destroy it. Are the COVID-19 vaccines safe? Yes, the COVID-19 vaccines used in the United States were tested in clinical studies involving tens of thousands of people and were found to be safe. These studies were done to make sure the vaccines meet safety standards and protect people of different ages, races, and ethnicities. A safety board approved every study, and the FDA carefully reviewed the data from every phase of every vaccine trial. They continue to collect and review data to ensure that long-term effects are safe. How are the COVID-19 vaccines developed so quickly? You've probably heard a lot about the groundbreaking speed these vaccines were able to be developed. That's due to several factors. Number 1, the unusually high number of volunteers for clinical trials allowed enrollment goals to be met much faster than normal. Both private and government sectors invested billions of dollars, more than ever before, into vaccine development. This increase in funding allowed for more widespread and thorough research. There was greater cooperation between leading medical experts and multiple companies, industries, and countries than any other vaccine in history. This cooperation helped speed up the process of vaccine development. It's also important to remember that researchers were not starting from scratch. Dozens of other coronaviruses provided an essential base for developing a vaccine. No steps were skipped or rushed during this process. Instead, many steps were able to operate at the same time instead of in a sequence. Think of this as putting these steps into swim lanes rather than a relay race. What vaccines are available and how many do I need? Different types of COVID-19 vaccines are and will be available. There are multiple COVID-19 vaccines in the developmental and approval process, and the vaccines that are currently authorized in the U.S. include Pfizer, Moderna, and Johnson & Johnson. AstraZeneca at this time is also working through the approval process. And by the time that you view this presentation, this information may have changed, so it's important to stay up to date by visiting CDC's website or other reputable sources. Most of the currently authorized vaccines are given in 2 shots, one at a time spaced apart. The first shot gets your body ready, and the second shot is given at least 3 weeks later to make sure you have full protection. If you're told you need 2 shots, make sure that you get them both, and make sure you get the same brand each time. The vaccines may work in slightly different ways, but all of the vaccines will help protect you. The vaccines that are currently authorized have been shown to offer a very high level of protection against contracting COVID-19, up to 95%, which is very high, and against developing severe disease if you do contract the virus. Now let's talk a little bit about the important things to know about the COVID-19 vaccine distribution plan. First thing to know, vaccination is optional and currently there's no cost to the individual. Also, multiple providers offer and will continue to offer the vaccine. Third, the Knox County Health Department plan follows the same plan set by the Tennessee Department of Health. Any Tennessean 16 and older is eligible for the vaccine, regardless of phase. If you're 16 and older and would like to get the COVID-19 vaccine, it's open to you. You can sign up on the wait list on our website or by calling our public information line, which is 865-215-5555. An additional resource is the CDC Vaccine Finder tool. This is a great resource to find other places such as pharmacies or hospitals that are providing vaccinations to those who are eligible. So what to expect when getting the vaccine? Some people may experience side effects, and we know that some people are concerned about these side effects, and we understand. So let's take a look at some side effects you may experience after receiving your vaccine. First thing to know is that the likelihood of severe side effects is less than 0.5%. Most people will experience mild side effects such as a sore arm, sore muscles, feeling tired, or a mild fever. Most of these side effects will go away in a few days. Remember, these mild side effects are a normal sign that your body's building the protection to the virus. Having side effects does not mean that you have COVID-19. Even though you get a vaccination, you need to still wear a mask and continue to practice the 5 core actions like physical distancing, wearing a cloth face covering, proper hand washing, cleaning and sanitizing surfaces, and staying home if you get sick. Right now, scientists and experts don't know how long the vaccine will protect you. So this is why it's a good idea to continue practicing the 5 core actions to best protect yourself. Typically, it takes about 2 weeks after your second shot to have immunity kick in. Now let's go through a few commonly asked questions. Will I get COVID-19 from taking the vaccine? No. According to viral immunologist and scientific lead for the Moderna vaccine, Kimmechia Corbett, the COVID-19 vaccine does not replicate like the actual virus. You cannot get the virus from taking the vaccine. The vaccine alerts your body of what the virus looks like and produces a snapshot of it. So when the virus shows up, your immune system recognizes it and is postured and ready to fight it. Were the COVID-19 vaccines developed using fetal tissue? No, these COVID-19 vaccines were not developed using fetal tissue. Some vaccines are developed using cell cultures, but mRNA COVID-19 vaccines were not developed in that way. Will the COVID-19 vaccine alter my DNA? Many of the current COVID-19 vaccines are messenger RNA or mRNA vaccines. mRNA is not able to change a person's genetic makeup or DNA. The COVID-19 vaccine gives a recipe to the body that is used for a short time to make a protein that's found in the virus that causes COVID-19. The body sees that protein doesn't belong, makes antibodies to the protein, and when the body someday sees that virus, it remembers the protein and knows how to destroy it. Can the COVID-19 vaccines cause infertility in women? There's no information to support this claim and no reason why the vaccines would cause infertility. Is it true that the government is issuing a card to prove someone has received a vaccine, which will exempt people from mask and distancing requirements? There is no card given to verify who receives the vaccine. A reminder appointment card with vaccine information is given to people when they receive the first dose to let them know which vaccine they received and when to get their second dose. Is it true that the COVID-19 vaccine was developed to control the general public through microchip tracking? There is no vaccine microchip. The vaccine will not track people or gather personal information for a database. We've now reached the end of our presentation, which we hope that you found educational and informative. If you'd like additional information about the COVID-19 vaccines or would like to stay up to date as the situation changes, feel free to visit the Knox County Health Department's website, which is covid.knoxcountytn.gov/vaccine-info. The Tennessee Department of Health, the CDC, Johns Hopkins, and National Institutes of Health websites are also great resources to find additional information. Thank you.